Hi everyone, today I will tell you about the stoma bag change procedure. Generally, we have to change the bag when our bag is leakage or during the routine change. In ileostomy cases, we change the bag within the 5 days, and in colostomy and urostomy, we change the bag within the 7 days. If you are changing the bag routinely, then you have to change your bag early in the morning or before the breakfast or after the 4 hours of meal, because at that time your stomach will remain the quiet and inactive, and in case of accidental leakage you have to change immediately. So how to change the bag, I will tell you step by step. Firstly, you gather the stoma appliances and their accessories what are the using. You have to take this one garbage bag to collect the waste material in this and discard it properly, and take the stoma bag whichever is suitable to you and which you are using. Take a bowl with normal water. There is no need to add anything Dettol or Savlon in this, and always take the normal tap water for cleaning. And next is stoma measuring guide. You have to use this for measure the stoma, and take your pen for the marking the stoma size according to the measuring guide. And this is the curved scissor. You have to cut your bag in the curved shape, so we can remove the edges by this scissors. And this is the ostomy paste which is used to adhere the stoma bag on the peristomal skin. And this is the ostomy powder to heal for the excoriation, any redness surrounding the stoma. So we have to use this ostomy powder. And next is adhesive remover, which is the sting free remover. So we have to use to remove this bag from the skin. And this is the deodorant, which is used as a lubricant and used as a perfume also, and it controls the bad odor of the stool. So we take the 4 to 5 drops in this bag, so it works as a lubricant. So when your stool comes from the stomach, it will comes down easily and not stick on the bag. It is not necessary to use for the ostomy procedure, but it is available in the market. So if any ostomist wants, so they can purchase as a accessories for them. And this is the Micropore Tape, so we use on the surrounding of the ostomy bag. And this is the washcloths, and this is tissue paper. And after gathering all the items, you empty your stoma bag into toilet and wash your hands with soap and water. For removing the bag, you can use the adhesive remover or you can use the water also. And always remove the bag from the upper side. One hand should be on the skin and another on to peel off the bag. Now I am using the sting free adhesive remover to remove the bag. So you can use this sting free remover on the fragile skin and where the skin is excoriated. So you have to peel off from the upper side or one border and then spray over there. Slowly you spray and remove this bag from the peristomal skin and discard into the dustbin. Take a gauze piece to clean the surrounding skin and the stoma skin. So first you take the dry gauze cloth and dip into the normal water and squeeze it and clean from the peristomal skin first. So we have to clean from the surroundings of the stoma. And then you have to turn your gauze and clean the stoma gently and discard it into the dustbin. And take a dry gauze piece now. So we have to dry the surrounding area from the peristomal skin. We do not dry the stoma because the stoma is already moist. First we have cleaned and now we have to dry the peristoma skin with the dry gauze piece, and we have to apply the stoma powder on the peristomal skin. This powder should not be poured on stoma, and we have to spread the ostomy powder on the surrounding skin like this. After spreading, we have to measure the stoma size with the help of this measuring guide. First we will take the small one, which is the 25 centimeter. We will see it is not appropriate for the size, and we will take the next one, which is larger than the 25 centimeter, 28 centimeter. So it is very fitting to this. So we take the next size of 32 mm. So this size will be appropriate for the stoma. You can see this is have the gap of 3 mm larger than the normal stoma size. So this gap will be filled by the stoma paste, and we should not to take the fixed or small size because it will interrupt the blood supply to the stoma, and not to take the larger size because when stoma content comes in the contact with the peristomal skin, the skin redness and excoriation will develop. So take the appropriate size of bag and apply the measuring guide on the stoma bag and mark with the pen. Marking size also available on the stoma bag. So according to the measuring circle, we can see the measuring size on the stoma bag, and we have to mark this size accordingly and cut the stoma bag with the curved scissor in the round shape. So like this we have to cut in the round shape. I have cut it to 35 mm size according to the stoma. Now I will check for any sharp edges. If present, then I will cut and give the round shape with the help of curved scissors again. So if any edges are remain, which makes the cut on the stoma, and I will remove the upper layer of stoma bag. So, and I will apply the stoma paste on the inner side of the stoma bag on the inner layer. Earlier we have taken the 3 mm exercise, which is covered by this paste, and I will dust off the powder which we have spread earlier. We do not clean with the water, we have to dust off only. After dust off, we will apply the stoma bag and make the proper seal. Our stoma size was 32 and we cutted the bag on 35 mm, 3 mm extra. So this paste will make the seal around the 3 mm. So stool will not comes in the contact with the skin, and we apply on our peristomal skin like this. We have to press from the surrounding, not to press the stoma. If the stoma paste or powder will comes on the stoma, it will not harms to the stoma. I have pasted the bag, and now you can see there will be no gap between the stoma bag and the stoma. That 3 mm gap is filled by the stoma paste. Now you can check the all sides from the surrounding, either it is pasted well or not. If edges are not stick well, then you can use the adhesive tape on the border of the bag. So if you can use this Micropore or a semicircular adhesive tape which is available in the market. On both sides you can use 2 adhesive tape. If not available, then
we can use the micropore. And micropore is not indicated for the fragile skin or skin expression. Now you have to cut this micropore in this side and you cover the all border of the stoma. Now you can check the all borders for any leakage or open space. Now you have to press with the palm like this, not to press on the stoma, on the surrounding skin, and you have to press like this and press it for 5 to 10 minutes, or you have to take the rest for 15 minutes for better sticking.
And if your stoma bag is leaking very frequently, then you can apply the stoma belt and abdominal binder also. While using this stoma belt and abdominal binder, you have to use while walking and sitting, and you have to remove both the belt and abdominal binder while you going for sleep. Thank you.